change over time. In other cases, it can be due to chewing or swallowing problems. A lot of the elderly have dentures. With changes with weight, these dentures can become ill-fitting and make it difficult for them to chew and swallow. Also, it can be due to loss of an appetite caused by a diminished sense of taste and smell. Those taste buds sometimes aren't working as well as they could. In an older person, the intestines may have difficulty absorbing certain nutrients, and loss of muscle tone can reduce peristalsis. Peristalsis is that wave-like intestinal movement that moves food along in the intestinal tract. When it becomes sluggish, it can cause constipation. Encouraging fibrous and whole grain cereals such as bran muffins, broccoli, breads and cereals will provide bulk to help maintain normal stool formation. Provide fluids for the individual. Getting enough fluids can help prevent constipation. Though water is important, fluid of any kind can be used. Things like water-based soups, juices, decaffeinated tea are all things that can be used. Limit the amount of caffeinated coffee or other drinks, however, because they really act more as a diuretic than as a fluid that can help retain water. Be aware of food preferences and habits. For the most part, older people enjoy the same foods that they have always liked. That means if they are used to having meat and potatoes when they were younger, that's probably what they're going to want to eat now. Ask older people what their personal and cultural food preferences are. Many older people find that they need to urinate more often than they used to. By the age of 40, the kidneys begin to show evidence of wear, and by the time an individual is 80 years old, the blood flow to the kidneys has been reduced by an average of about 50 to 55%. This reduced blood flow means reduced functioning and filtering ability of the kidneys. The reduced functioning means that the kidneys get smaller and urine formation or production is less efficient. Muscles and ligaments in the urinary system become stretched from age, but also from childbearing years. This makes the bladder emptying more difficult, and nocturia, which means frequent urination during the night, and incontinence a potential problem. What this translates for you, the caregiver, is the importance of prompt assistance with toileting for these individuals. Older people, like young people, very young people, have difficulty holding urine, so respond to the call lights and requests for toileting as quickly as you can. Also, carefully following a bladder training program and encouraging fluids earlier in the day is important. Be sure that you limit the amount of fluid that's given to the older person in the evening and nighttime hours so that they are not interrupted a lot during the night. The integumentary system refers to the skin, hair, and nails. The skin is the largest organ of the human body, and no matter what the age, healthy skin is the single most important protection against health hazards. Skin loses the ability to retain fluid, making it more dry and prone to wrinkling. Limiting the frequency of bathing, sometimes only once a week or maybe twice a week, and use of lotions can go a long way to help prevent drying of the skin. Areas of brown spots appear on the skin of an older person. Usually these are on the hands or on the face. Sometimes they're called old age spots or liver spots. Actually, they have nothing to do with the liver, but rather are caused by a reduction in blood supply and hormonal changes in the aging process. Aging skin becomes thinner and more fragile, and provides less support to the blood vessels underneath. The skin may tear and bruise more easily. Even a light bump, so light that the individual does not remember how it happened, may cause a bruise. This means that you need to take care when helping people, handle them gently, and avoid injury by being watchful of equipment and furniture that the individual might bump into. A while ago, I worked as a home health nurse. One day, I was just walking in the door of a home where a son was caring for his elderly father. The elderly gentleman was sitting in a chair, and not only did he have fragile skin due to his advanced age, but also he was on some corticosteroid medication, which made the problem even worse with skin fragility. The son was about to help his father out of the chair, and he grabbed the father's forearms to lift him up out of the chair, and in doing so, the skin literally rolled up towards him, towards the wrist of the elderly man, as the son pulled his father to a standing position. This certainly could have been avoided had he known or implemented safe handling of his father. Prolonged pressure over bony areas reduces blood supply to the tissues and can produce pressure ulcers. Frequent position changes, probably as much as every 1 or maybe every 2 hours, is necessary for those who spend a great deal of time in bed or sitting in a chair to prevent skin breakdown. Because aging usually means many years of skin exposure to radiation from the sun and other exposures, older people are at increased risk for skin lesions such as malignant melanoma, which is a very dangerous form of skin cancer. Help protect their skin from further harmful rays by using sun hats, long-sleeve shirts, and pants when going outdoors. Changes in texture, distribution, and color of hair also occur over the years. Loss of pigmentation typically turns the hair white or gray, and with age, men and even sometimes women will have thinning of their hair or baldness. This is due to hormonal changes and other factors. Fingernails and toenails can also become thickened and brittle as the age progresses due to poor circulation. Keeping nails clipped short and soaking nails in warm water before trimming to soften them can help with this problem. Even so, it may be necessary to have a professional take care of the older person's nails. Special senses, including the eyes, ears, taste, smell, and touch, also change with age. The human eye is so well constructed that it can be expected to function efficiently throughout life. But there are significant changes in vision that normally occur with aging. The fact that our eyes are used oftentimes, are donated to an eye bank, testify to the fact that eyes do last a lifetime and well beyond that.